Welcome to the deep dive. Today we're jumping into something really critical, youth mental health. It's quite sobering when you hear the stats globally, maybe 1 in 5 young people, but in the US, it could be as high as 1 in 2 facing mental health challenges. It's a massive issue. But what's fascinating, and what we're exploring today, is how this thing right here, your smartphone, might actually hold a key to revolutionizing support. So, our mission in this deep dive is to unpack the findings from a big umbrella review looking at 30 different studies. It's all about how mobile assessments, using phones, are starting to monitor and even intervene in youth mental health. There's some pretty surprising things coming out of this and some really exciting potential. So, let's get started. Where do we begin with how these phones are actually used? It's kind of amazing how much these devices know. When we talk about using them for mental health stuff, what are the main ways people are doing it, like the main approaches?
Right. Well, there are basically two main streams here. The first is what's called ecological momentary assessments, or EMAs. You can think of this as the active approach.
Yeah. Active, meaning the person has to do something.
Exactly. You, the user, get prompts on your phone, little questionnaires asking about, say, your current mood, your thoughts, maybe what you're doing right then. And the huge advantage here is getting past what researchers call retrospective recall bias. How hard it is to accurately remember how you felt yesterday, let alone last
Oh,
week.
yeah, definitely. Ask me what I had for lunch Monday, and I'd struggle.
Precisely. So emails capture feelings and context in the moment. It's about real-time data.
Okay, that makes sense. So that's the active way. What's the other approach?
The other one is digital phenotyping. And this is the passive method. It uses all those sensors already built into your smartphone.
Like GPS, motion sensors?
Exactly. GPS, the accelerometer, which tracks movement microphone data, sometimes even things like your screen time, how you're using apps, call patterns, even analyzing aspects of your speech if you consent. And the key here is it's continuous and pretty unobtrusive. It's collecting data about your state, your behaviors, your environment, often without you having to actively do anything.
Wow, okay. So one is asking you things directly. The other is sort of observing your digital footprint and behavior patterns in the background.
That's a good way to put it. And both methods allow researchers to see these dynamic, real-world changes within a person, day to day or even hour to hour, in ways that were just impossible before.
That's fascinating. What kind of insights can you get from that passive data? You mentioned predicting things.
Yeah, it's pretty amazing. For example, studies are finding links between patterns of smartphone use and certain brain network activities. Some research even suggests you can predict personality traits just from someone's digital traces. It's getting really granular.
Incredible. Okay, so we have these powerful tools, active and passive. What are they actually revealing about mental health conditions? What are the main applications right now?
Well, they're being used across a really wide range: depression, anxiety, bipolar disorders, schizophrenia, even looking at things like suicidal thoughts, general well-being, cognition, and personality.
So quite broad. Can you give some specific examples of what we've learned?
Sure. EMAs, the active ones, have been really good for tracking those daily ups and downs in mood for people with depression. They can show how things like, say, caffeine intake or scrolling social media might impact how someone feels moment to moment. And here's something quite profound, especially regarding suicidal ideation. EMAs have shown that the variability, how much those thoughts fluctuate, can actually be a more reliable indicator of risk than just how intense the thoughts are.
Wow, that's a really different way of looking at risk, not just if someone has the thought, but how changeable it is.
Exactly. It's about the dynamics. And then with passive data, think about wearables like Fitbits or smartwatches. They're often used to track sleep patterns, and we know sleep is tightly linked to depression. So your watch could potentially quietly pick up on changes in your sleep that might be an early warning sign.
Right, like a personal warning system?
Sort of, yeah. The potential is there for creating personalized alerts for relapse risk, maybe changes in how much someone is going out based on GPS, or changes in communication patterns. It helps bridge the gap between what happens in a therapist's office and someone's actual everyday life. It's what some people are calling minimally disruptive medicine support that fits into your life.
And it's not just about monitoring, right? You mentioned interventions too.
Yes, EMIs, ecological momentary interventions. These are like small, just-in-time interventions delivered via the phone, maybe suggesting a coping strategy when stress is detected. They're showing promise, particularly when they're part of a broader support system with professional help. Studies show a medium effect size, which is quite encouraging.
Okay, this all sounds incredibly promising. Let's talk about the opportunities. Where could this technology make the biggest difference?
I think one of the biggest opportunities is in global mental health, especially in low and middle income countries, or LMICs.
Why there specifically?
Well, that's where most people with mental health issues actually live. But access to traditional care is incredibly limited. Something like 90% of people don't get the help they need. Mobile solutions could potentially leapfrog some of those barriers. They can be more accessible, maybe reduce stigma. It's a huge potential upside,
That makes a lot of sense, using the tech people already have.
right? And there's also this interesting shift happening, moving beyond just treating illness or ill-being toward actively promoting positive mental health, things like happiness, purpose, well-being. Mobile tools could play a role there too.
Okay, the potential is clear. But what are the catches? What are the big challenges or questions we still need to answer?
There are definitely significant hurdles. One major issue is what's sometimes called data absenteeism,
Meaning,
meaning we often lack good, solid data from more vulnerable groups,
Hmm.
people from lower socioeconomic backgrounds or certain racial and ethnic minority groups. If the tools are mostly tested on affluent university students, how well will they work for everyone else? That's a big gap.
yeah, that's crucial for equity. What else?
Validation is another challenge. How do we make sure the data from a phone sensor or a quick EMA truly matches up with traditional validated mental health assessments? The ground truth, so to speak. It's not always straightforward. And then, of course, the ethical considerations are massive. Privacy, transparency, consent. Users absolutely need to understand how their very personal data is being collected, how it's being analyzed, and what it's being used for. That trust is paramount.
Absolutely, the privacy implications are huge.
They really are.
Yeah.
And the core challenge is shifting. It used to be just collecting all this complex data, sensor data, survey data, maybe voice data, what they call multimodal data. Now, the bigger challenge is actually analyzing and modeling it effectively to pull out meaningful, reliable insights. That requires serious collaboration between computer scientists, psychologists, ethicists. It's a real team effort.
So wrapping this up, it sounds like mobile assessments are really driving a kind of a digital shift in mental health, offering this potential for real-time, personalized support, especially for young people.
I think that's right. It's early days in many ways, but the trajectory is definitely towards more integrated, data-driven mental health support.
It really makes you think. So here's something to leave you with. Imagine a future where your smartphone isn't just a tool, but could ethically become a kind of proactive partner in managing your own mental well-being. If that's where we're heading, what responsibility do we all have, developers, clinicians, users, policymakers, to make sure this powerful technology genuinely helps people flourish and doesn't just become another way to harvest data? Something to consider.